Let's Talk Lungs with Trent and Lori from Lung Saskatchewan. Dedicated to connecting you with lung health experts and key opinion leaders who will share current, evidence-based lung health information to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the territory of the Métis.
On this episode of Let's Talk Lungs, we're joined with Dr. Moaaz Rashad. Dr. Rashad is a Saskatoon-based respirologist who provides specialist care for people living with lung and breathing conditions with a clinical interest in pulmonary hypertension.
This episode of Let's Talk Lungs is sponsored by AstraZeneca. AstraZeneca is a science-based biopharmaceutical company focused on delivering life-changing medicines across several disease areas, including respiratory and rare disease. Thank you to AstraZeneca for supporting conversations that help bring practical lung health information to people across Saskatchewan and beyond. Trent, today we are talking about pulmonary hypertension, or PH, and I have to say this is one of those topics where the name can throw people off right away.
Absolutely. A lot of people hear hypertension and think, okay, blood pressure cuff, family doctor, maybe a medication, but pulmonary hypertension is different. This is the pressure in the blood vessels of the lungs, and it can have a big impact on breathing, energy, and day-to-day life.
Yeah, and it can be tricky because the symptoms can sound like so many other things. Shortness of breath and fatigue, feeling simply wiped out after activities that used to be manageable. So it can be easy to explain those things away, especially when life is busy.
Right. And that is really why this conversation matters. We're not trying to turn everyone into a specialist today, but we do want to help listeners understand what pH is and why it can be hard to diagnose and when symptoms deserve that next look.
And we're also going to talk about what life can look like after diagnosis, because people need more than a medical definition. They really need practical information, support, and a sense that they don't have to figure this out alone.
And to help us do that, we are really pleased to welcome Dr. Moaaz Rashad to the conversation.
Dr. Rashad, thank you so much for joining us today. We always appreciate the chance to bring new voices to our listeners and are especially glad to have you with us for a conversation on pulmonary hypertension, a condition, that many people have heard of, but they may not fully understand.
So before we get into pulmonary hypertension itself, we would love to start with you and tell us a little bit about your path into medicine. What first drew you into this work and led you specifically toward respirology?
Great. Well, thank you so much for having me. It's really a pleasure to be here. I was always interested in science and problem solving, but really what drew me to medicine initially was the opportunity to use that knowledge to help people in a very direct way. Then that led me to internal medicine, and during my training there, I found myself becoming more and more interested in respirology. A big draw for me was that it's such a broad field. We care for patients with everything from asthma and COPD to sleep disorders, interstitial lung disease, and our topic of conversation today, pulmonary hypertension. And I really love the diagnostic side of it. Many patients come in as a bit of a mystery, and working to piece together what's going on is incredibly rewarding. I also value the long-term relationships that we're able to build with patients. I was very fortunate to train with excellent respirologists here in the province who have been incredible mentors and who have been a big influence on my career path.
Yeah, for sure. And along the way, I'm curious, what was it about pulmonary hypertension that captured your interest? It is such a complex area. It sits at the intersection of breathing, circulation, diagnosis, and long-term care.
Well, it's really a combination of things that came together during my respirology training. At first, I was drawn to the same things that drew me to respirology in the first place, especially the diagnostic challenge. There's a lot of detective work involved, thinking through different possibilities, doing a careful workup, and then building a treatment plan that fits the patient. Really, no two patients that come in through the door in our PH clinic are the same. I also really liked how multidisciplinary the field is. You get to work closely with other respirologists, cardiologists, rheumatologists, pharmacists, and many others. And it's really a team-based area of medicine. And lastly, pulmonary hypertension specifically is an area where more specialists were needed here in Saskatchewan because very few people are trained to manage this condition. And so all of this together eventually led me to pursue a fellowship in pulmonary hypertension out at McMaster University. And after training there, I was excited and honored to come back to Saskatchewan and join the provincial pulmonary hypertension program.
So, Dr. Rashad, let's start with the basics. And for listeners who may be completely new to this topic, what is pulmonary hypertension and how is it different from the high blood pressure that people may be more familiar with?
Yeah, that's a perfect place to start. And this is something that I explain quite often. When people hear hypertension or high blood pressure, they often think of the number that you measure with a blood pressure cuff on the arms. And pulmonary hypertension is in fact quite different than that. And it refers to high blood pressure in the blood vessels of the lung. And so when the pressure in the lung blood vessels is too high, the right side of the heart has to work harder to push blood through the lungs. And over time, that extra strain can lead to symptoms like shortness of breath, fatigue, dizziness, swelling in the legs, and sometimes fainting. And so, although both conditions use the word hypertension and are related to pressure, they're actually quite different. And while hypertension or just regular high blood pressure is quite common, pulmonary hypertension is much less frequent. And they have different tests, different causes, and very different treatments.
Mm-hmm. So when a patient and their family is sitting in your office and you have to explain pulmonary hypertension to them for the very first time, what do you usually want them to understand right away about what's actually happening in the body?
Well, I usually start with the basics because the truth is most people who come into our clinic have heard very little about pulmonary hypertension, and it's an entirely new diagnosis for them. I often start by drawing a simple picture of the heart and the lungs on a piece of paper. And somewhere around that point, I usually remind the patients that I went to medical school and not art school. But then I explain that your heart has two different sides. The left side pumps blood to most of the organs in your body, your brain, and it supplies oxygen to all of those areas. But then the right side of the heart, it's the less strong pump, and its job is to pump blood through the lungs so that they can pick up oxygen again. And then if the blood vessels in the lung become narrowed, stiffed, blocked, or for other causes, the heart then has to push much harder to move blood through. One comparison that I often use is pinching a garden hose. And so you can imagine that if you narrow the hose, the pressure behind it builds up and it makes it harder to pump water through. And then you can run into problems with the pump not working as well, or potentially water backing up and leaking elsewhere. And that's essentially what's happening to the right side of the heart. And once patients understand that basic idea, we can then go on to talking about why this happens, what type of pulmonary hypertension they have, and what we can do about it. At the same time, I also try to reassure patients early on that they're not going to navigate this alone, that we have a team around them, and that we will take things one step at a time.
So do we know what causes pulmonary hypertension? Like, can you walk us through some of the main categories or reasons someone might develop PH?
Yeah, absolutely. One important thing to know is that pulmonary hypertension isn't really one single disease. It's more of an umbrella term for anything that causes high pressures in the blood vessels of the lung. And so we divide pulmonary hypertension into different categories based on what's causing it. One category is pulmonary arterial hypertension, or PAH. And that's where the main problem is the small arteries of the lungs themselves. And that's the form of pulmonary hypertension that we have the most number of specific targeted treatments for. But there are also a lot of other causes as well. Pulmonary hypertension can happen because of left-sided heart disease. And this is actually the most common cause of pulmonary hypertension. And it's the result of pressure backing up from the other side of the heart through the blood vessels of your lung. Pulmonary hypertension can also happen because of chronic lung diseases like COPD or interstitial lung disease. Um, Chronic or long-standing blood clots in the lungs can also be a cause for pulmonary hypertension, and the list goes on with other rarer causes. And this classification is extremely important because treatment depends heavily on the type of pulmonary hypertension that you have. A medication that is effective and helps for one form of pulmonary hypertension might not help and can potentially be harmful for another form. And so, establishing establishing a clear diagnosis is absolutely critical. It's also important to say that pulmonary hypertension exists on a spectrum. And so some people have milder disease that stays stable for years, or that's controllable with pill medication. And there are other folks who have more advanced disease that needs more intensive treatments. And this can include things like infusion medications, and in some cases, a lung transplant.
I'm curious, are there particular populations or risk factors that make someone more likely to develop pulmonary hypertension?
Definitely. And recognizing those risk factors can make a huge difference because it can help us catch the condition earlier. So generally, when we talk about pulmonary arterial hypertension, it tends to be more common in women. It can also be associated with conditions such as connective tissue diseases or autoimmune diseases, especially scleroderma, as well as other conditions including congenital heart disease, HIV, liver diseases, and in some cases, inherited genetic factors. And then more broadly speaking, pulmonary hypertension can also develop, as we discussed, in patients with significant left-sided heart disease, chronic lung diseases, and blood clots in the lungs. And so, keeping an eye out on those specific patient demographics is very important. And this is something that more recognition for has developed over the last several years.
So, because PH can be difficult to recognize early, what are some of the common symptoms or warning signs that should prompt someone to speak with a healthcare provider?
Well, the most common symptom is shortness of breath, particularly with activity. And so people might notice that climbing stairs, walking uphill, or walking long distances is harder than it used to be. And as pulmonary hypertension progresses, some people develop dizziness with activity, chest discomfort, palpitations or feeling their heart beating funny, swelling in the legs, and potentially fainting. Now, the tricky part is that none of those symptoms are unique to pulmonary hypertension, and they can happen for many other conditions. And this is one of the reasons why diagnosis of pulmonary hypertension can be delayed. But if someone has shortness of breath or fatigue that's getting worse and there isn't a clear explanation, it's definitely worth speaking with a healthcare provider and getting it looked into.
Well, we are going to take a short break and get right back to our conversation with Dr. Moaaz Rashad.
Lung Saskatchewan has long been associated with leadership in lung health education. Whether you enjoy webinars, videos, podcasts, or practical resources online, Lung Saskatchewan is here to support learning that helps people breathe better and live well. Visit lungsask.ca to learn more.
Welcome back, listeners. Dr. Rashad, before the break, we were talking about symptoms and warning signs. So one of the things we often hear with pulmonary hypertension is that it can take time to diagnose because symptoms can overlap with many other conditions. So why is PH sometimes so difficult to identify early?
You're absolutely right. And pulmonary hypertension hides in a couple of ways. And so as we were saying before the break, the symptoms overlap with many more common conditions. And in the grand scheme of things, pulmonary hypertension is not a common diagnosis. And so it makes sense that clinicians often investigate for the more common possibilities first, including things like asthma, deconditioning, coronary artery disease, many things that are a lot more common. But the second part is that patients are often adapting without realizing it, and people adapt remarkably well. Pulmonary hypertension generally develops and progresses very slowly over time, and so folks will gradually stop taking the stairs or park closer to the entrance. They'll avoid hills or longer walks, and because these changes happen gradually, they might not recognize how much their activity has changed. And one thing I hear quite often is, well, I didn't realize how much I'd slowed down until, my partner or my children pointed it out.
So then when PH is suspected, what does that diagnostic journey usually look like? What kinds of tests or assessments might be involved in confirming the diagnosis and understanding what type of PH someone has?
hmm So the workup is fairly detailed because we need to answer two main questions. The first is, does the patient truly have pulmonary hypertension? And the second is, if they do, then what type is it? Oftentimes, testing starts with an echocardiogram, and so this is an ultrasound of the heart, and we can use that to get a general idea of how well the heart is functioning, what the pressures are like on both sides of the heart. And then we'll also commonly do lung function testing. We'll do imaging of the lungs, blood work to look for different markers of autoimmune disease and strain on the heart. We'll also try to look for blood clots that are in the blood vessels. And so it's often a wide gamut of testing. And then the definitive test to diagnose pulmonary hypertension is a procedure called right heart catheterization. And this is generally done by the interventional cardiologist. And it involves passing a thin catheter through a vein all the way up to the heart and directly measure the pressures inside the heart and lungs. It's a bit of an invasive procedure, but it's very important because it allows us to confirm the diagnosis, describe the condition in better detail, but also understand the severity and make safe treatment decisions.
Okay, then, Dr. Rashad. So, at what point would someone typically be referred to a specialist, and why does it matter to get that expertise involved early?
Well, ideally, patients should be referred once pulmonary hypertension is being seriously considered. And that doesn't mean that every test has to be completed before the referral. And in fact, often involving a specialist early can help to guide the workup and avoid delays. We know that earlier diagnosis and initiation of treatment is associated with better outcomes. And practically speaking, we receive referrals from family physicians, cardiologists, respirologists, and other specialists in various stages of the journey, and all of those pathways are appropriate.
So once a person receives that diagnosis, I imagine it can be fairly overwhelming. From your perspective, what are some of the first practical conversations you have with patients after that diagnosis is made?
The first thing I try to do is acknowledge that it can be a lot to take in, and oftentimes when we're first making the diagnosis, it involves me talking a lot, and so it's important to pause and check in on the patient and clarify things, and then I try to explain to the patient that everybody is unique and that pulmonary hypertension is not the same for everyone, and really needs to be taken in the context of the specific patient. Some people come in with information that they have looked up online or they've Googled, and a lot of times what they're reading online is very different than their specific situation. I then also want to make sure that the patient leaves the conversation knowing that they're well looked after and that we have a plan in place. And so I want to clarify for them, what steps in doing further testing are going to look like, what different treatment options and strategies could be, but also, there's a lot of counseling as to what to watch out for. Oftentimes, I'll tell them, if you see this, For instance, like if you see that your blood pressure is dropping, let me know. If you see that you're getting more swelling with this medication, please let me know. Um, and so often, like getting them to understand that and process it is absolutely critical. I'll also encourage family members or support people to be part of that conversation whenever possible, because pulmonary hypertension affects more than just the patient. It often affects the whole family, and also having another set of ears, another person who knows what to look out for, is incredibly valuable.
Okay, so let's shift into daily life. You mentioned earlier that people may not notice subtle changes in themselves. So, what are some of the ways a pulmonary hypertension can affect everyday routines? Things like work and walking, sleep, energy, travel, or, even as you mentioned, planning around family life.
Yeah, and I mean, breathing is a part of essentially every activity in your daily life, and so really pulmonary hypertension can impact all of those aspects of one's life. Things like walking, climbing stairs, work, travel, um, and keeping up with other family activities. They all need more energy and planning than they would before. Um, and so some people need to think carefully about, what their oxygen
Hmm.
needs are, about pacing themselves, resting, the logistics of using, their medications and treatments. And so there's really a lot that goes into it. But in addition to all of that, there's also an emotional adjustment that comes with changes in your physical capacity and being on different treatments, and that part is very challenging for patients, and something that we try very hard to address alongside all of the medical aspects of
So
the
then for
condition.
someone living with PH, what are some of the practical strategies that can help them manage day to day and conserve energy without feeling like life is completely narrowed around the disease?
Yeah. Well, one thing that patients are often surprised to hear me recommend is I want you to
Hmm.
still be active and to exercise. Um, it's easy that when you start becoming a bit more limited in your activities, that you want to do less, and and often that's not the
Hmm.
best path forward. Of course, it needs to be appropriate for the person, and in a lot of cases, like supervised exercise, or guided exercise is necessary. But without a doubt, regular physical activities is extremely beneficial. At the same time, I also talk about pacing, and so that means is spreading your activities out throughout the day, building in rest periods, knowing where your limits are, and balancing things out so that you will sometimes get close to your limits, but you're not over exceeding them. And with that, the goal is to find ways for patients to lead full lives that are safe and sustainable and that keep their body active.
Well, we know support matters too. So, what role do family, caregivers, respiratory teams, and patient organizations like ours at Lung Sask play in helping people live well with PH?
Oh, well, they play a huge role. And family members and caregivers, they often help our patients with navigating some of the complicated medications that they're sometimes on, different appointments, monitoring symptoms, as well as the emotional side of living with pulmonary hypertension. We are also fortunate to have like patient organizations like Pulmonary Hypertension Association Canada that can be incredibly helpful, and they provide education, advocacy, and peer support. And sometimes just hearing from another person who understands what you're going through can make a big difference. And so, really, nobody should feel that they have to manage pulmonary hypertension
Well
alone.
said. Treatment has come such a long way, and without getting too deep into the weeds, can you give us a practical overview of how pulmonary hypertension is treated and what the goals of treatment generally are?
Yeah. really, treatment depends entirely on the type of pulmonary hypertension that we're talking about. So for pulmonary hypertension related to left-sided heart disease or lung disease, we often focus on treating and optimizing sort of the underlying condition, and that might mean managing heart failure with water pills um, and other goal-directed medical treatments, treating lung disease, treating low oxygen levels with extra oxygen. And many things that relate to those specific conditions. When we talk about pulmonary arterial hypertension, uh, so that in that area, treatment has advanced dramatically over the past couple of decades, and we now have several targeted treatments that work on the blood vessels in the lungs, and they can help to relax those blood vessels, improve blood flow, and reduce the strain on the right side of the heart that's responsible for pumping blood through the blood vessels of the lung. Very recently, we got approval for a new medication in an entirely different class, and it's called sotatercept. And what makes it special is that it's very different from our existing therapies, and the clinical results have been very impressive. And so this is actually a very exciting time for us in the pulmonary hypertension world. I'll also say that we often use combinations of medications earlier than we used to, because we're recognizing that outcomes are better when we treat the disease aggressively. Uh, a Another type of pulmonary hypertension is called chronic thromboembolic pulmonary hypertension, and so this is a form that's related to blood clots that in the lungs that don't go away. And this type of pulmonary hypertension is it can actually be curable with surgery to remove those blood clots. And we don't do that specific surgery here in Saskatchewan, but we will regularly refer patients to specialized centers, um, mostly in Toronto and Ottawa, for that surgery if they appear to be a good candidate for that. And with all of these interventions, the goal is to first like reduce symptoms. We want to improve quality of life. We want to slow progression of the disease, and to protect the right side of the heart.
So, for someone who is newly diagnosed, or maybe for a family hearing this and wondering what to do next, Dr. Rashad, what would you want them to know about hope and support and the importance of not trying to navigate this all alone?
Uh, I want people to know that a diagnosis of pulmonary hypertension can be serious, but that often we have many tools to help us manage this disease. And we have far more treatment options than we did even 10 or 15 years ago. And many patients do much better today than they would have in the past. And as I mentioned earlier, I'd encourage patients and families not to try to do this alone. And so your care team, patient organizations, and support networks can make a tremendous difference. And so while pulmonary hypertension can be challenging, many people continue to lead full and meaningful lives with this condition.
Well, as we start to wrap up, what is giving you hope right now in this area? Whether that is better awareness, better treatments, or simply a better understanding of what people with PH need to do to live well.
Well, quite a lot, honestly. Uh, what excites me most is how quickly the field is moving. We're diagnosing patients earlier, we're tailoring treatments more effectively, and we're seeing new therapies emerge that weren't available even a few months ago. And there has also been growing awareness, both amongst patients and clinicians, regarding pulmonary hypertension. And this has really enabled earlier recognition, which can have a huge impact on the trajectory of our patients. And so I think there's a lot of momentum right now, both in patient care as well as research. And this gives me really a lot of hope that pulmonary hypertension is going to become more and more manageable as a disease in the years to come. And how we see pulmonary hypertension now is, well, it's very different than how we saw it a decade ago. And hope is that it'll also be very different than how pulmonary hypertension will be managed in the decade to
Well,
come.
Dr. Rashad, we can hear the care, the compassion, the hope that you bring into this disease state. And we just can't thank you enough for joining us for this episode. We appreciate you sharing your time, your expertise, and really helping us better understand pulmonary hypertension from the challenges of diagnosis to the realities of daily life. And most importantly, thank you for helping make a complex topic feel more understandable and certainly more human for our listeners.
So thank you so much for having me. It's been a pleasure.
Thanks for listening. If you enjoyed this episode and you'd like to help support Lung Sask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow Lung Sask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time. Produced at Sound Lounge by T-Bone.